Hello guys, I hope you guys are doing good. It has been a very long festival season, but I'm back with another video, and I want to start with a question. Do you know or have you ever seen a person with diabetes? I bet you do. 10% of the world population are people living with diabetes, and 80 to 90% of these people, they have diabetes type 2. So today I want to talk about diabetes. I'll be giving you a definition, some of the risk factors, and some of the tips you can use to manage diabetes. So without wasting a lot of time, let's get into the video. Diabetes is a condition which is characterized by having high levels of blood sugar, or let's say blood glucose. We usually have two main types of diabetes, that is diabetes type 1 and diabetes type 2. Diabetes type 1 is also called insulin dependent. This is when the beta cells in your pancreas are not able to produce enough or not at all any insulin to make sure that the blood glucose is absorbed by the cells. Number 2, we have type 2 diabetes, which is also called insulin resistant. In this case, your beta cells in the pancreas produce enough amount of insulin, but your body cells have become resistant to this insulin. So the glucose in the blood is not going to be absorbed into your cell. We usually have 4 main symptoms of diabetes. Number 1, we have polyphagia, we have polydipsia, we have polyuria, and then we have glycosuria. Before we continue, I'll be leaving my contacts down here. If you have anything that you wish to consult privately, use the number and you'll be able to reach me. Also, if you feel like you wish to support what I'm doing, also use the same numbers, and I will really appreciate so much. Thank you. There are a number of risk factors that can predispose you to having diabetes. Number 1, we have genetics. This is when you're born with genes that can predispose you to, having diabetes early in life or later in life. And then number 2, we have family history. This is when 1 or 2 of your family members have been diagnosed with diabetes before. There is a probability that you are also at risk of getting diabetes. Number 3, we have poor dietary practices. This is basically making wrong choices when it comes to food choice and food intake. Number 4, we have physical inactivity. This is a major contributor to overweight and obesity, which is also a factor that can predispose you to diabetes. When it comes to management of diabetes, we usually have the following. Number 1, we have insulin therapy. This is used in diabetes type 1. We usually use insulin injection to manage this blood sugar. Number 2, we have, we usually encourage our patients to indulge in physical activity, or rather adopt physical activity. This is necessary to make sure that they are able to cut their weight in a healthy manner. Okay, number 3, we usually encourage our patients to make dietary changes. That is, cut their carbs, take foods rich in fiber, consume a lot of fruits and vegetables, take proteins moderately, and then avoid saturated fats in their diet. So I will be making a video with the list of foods that a diabetic is allowed to take, and also the foods that he or she is not allowed to take. So be sure to check out my next video. Last but not least, we usually advise our patients to quit smoking or drinking. That is if they've been doing so before. Well, that's all for today, guys. Thank you for watching this video up to this point. I really appreciate so much. So if you have any question or any request, kindly leave it in the comment section and I will surely get back to you. Bye bye. See you in my next video.